Hi, beautiful people. How are ya? I hope you're having a great day. Well, we're finally getting through this COVID stuff. I'm negative now, been negative for several days. I recently had an eye doctor appointment yesterday. I might share that in a separate video, but on with what we're here for. Sjogren's disease, also known as Sjogren's or Sjogren syndrome, is a chronic autoimmune disorder. 1 to 4 million people in the United States are affected. Most are over 50 when diagnosed. Sjogren's occurs when the immune system attacks the glands that make moisture in the eyes, mouth, and other parts of the body. But our eyes and mouth are the most commonly attacked. Fatigue and joint and muscle pain are also common. The disease can damage the lungs, kidneys, and nervous system. Blood vessels, liver, pancreas, and brain can also be affected. Like fibro, the disease mostly affects women. Sjogren's can occur alone or with other autoimmune conditions like rheumatoid arthritis, lupus, and Raynaud's phenomenon. But this is another common overlapping condition or disease that occurs alongside fibromyalgia. Fibromyalgia is said not to be an autoimmune condition in nature, and you know my stance on that. Most of us believe that one of these days they're going to say it is autoimmune. So today, let's discuss the overlap of Sjogren syndrome and fibromyalgia. Here we go. Sjogren's disease symptoms that overlap with the symptoms of fibromyalgia include dry eyes, dry mouth, fatigue, muscle ache, vaginal dryness, acid reflux, trouble sleeping, poor concentration, and memory problems, along with numbness and tingling. The following are symptoms of Sjogren's that are not fibromyalgia symptoms: dry nasal passages and throat, and a dry cough. Skin rashes, swelling of the glands around the face and neck, shortness of breath or trouble breathing, joint pain, and muscle weakness. So keep this in mind, but I often have a dry cough or have shortness of breath, and sometimes I feel like my joints ache or I'll have muscle weakness, but I haven't been diagnosed with Sjogren's. So perhaps there is some overlap of some of these symptoms as well. Just curious, do you have Sjogren's and fibromyalgia or have the overlapping symptoms? Sjogren's, like fibromyalgia, can start at any age, but is most common in people in their 40s and 50s. All racial and ethnic backgrounds can be affected. The difference between the two are the following fibromyalgia symptoms: widespread pain, hyperalgesia and allodynia, stiffness, headaches, IBS, dizziness, feeling too hot or cold, restless legs, unusually painful periods, anxiety and or depression. This list doesn't mean you'll have all of these, but they are common among people with fibromyalgia. and are not normally on a list of Sjogren symptoms. Bottom line, Sjogren's reduces tears in the eyes and saliva in the mouth, resulting in dry eyes and mouth. Dry mouth affects taste, makes chewing and swallowing more difficult, and increases the risk for cavities, tooth loss, and infections in the mouth. Symptoms include feeling like your tongue and throat are dry. Your eyes may burn or itch, or feel as if you have a piece of sand in your eye. Vision may be blurry, or you could be bothered by bright lights. So with that information, let's move on to how a doctor diagnoses Sjogren's. Oh, it'll mess up my lipstick, and then I'll have food all stuck in my teeth. You better hold on to that, because I want that. I just don't want it right now because it'll be all stuck in there. Okay? A patient's medical history and a physical exam are the beginning of a doctor's diagnosis. In the physical exam, the signs of dry mouth or dry eyes are recognized. One issue is that some medications can also cause these symptoms. Clinical laboratory tests are then performed. Blood tests to determine the level of different types of blood cells are ordered. The presence of antibodies common in Sjogren's, or evidence of an inflammatory condition, as well as indications or problems with your liver or kidneys, are determined. A doctor may measure the dryness of your eyes with a test called a Schirmer tear test. A small piece of filter paper is placed under your lower eyelid to measure your tear production. An ophthalmologist might also examine the surface of your eyes with a magnifying device called a slit lamp and look for damage to your cornea. There are also imaging tests where the doctor can check the function of your salivary glands. Oh yeah, I gotta look something up. I don't know how to pronounce this. Test. A cyelogram or cyelogram, depending on which English pronunciation is used, is a special X-ray that detects dye that doctors inject into the salivary glands in front of your ears. The procedure shows how much saliva flows into your mouth. Wow, that's pretty cool. Salivary scintigraphy, not sure if I pronounced that right either, uses nuclear medicine where dye is injected into a vein of a radioactive isotope, which is tracked over an hour to see how quickly it arrives in all of the salivary glands. Additionally, a lip biopsy can detect the presence of clusters of inflammatory cells, which can indicate Sjogren's. A sliver of tissue is removed from a salivary gland in the lip and examined under a microscope, and I'm pretty sure they go down under here. That seems to be the most common procedure that is used. I mean, my rheumatologist, more than 5 years ago, suggested it. I opted not to have it done because my blood work was negative. So I decided not to go through all that. But researchers will often use salivary gland sonography. In a 2002 research paper, researchers stated that 22% of patients with Sjogren's syndrome also had fibromyalgia. 12.2% of patients with diabetes also had Sjogren's, which was not significantly different from Fibro patients. but only 3.3% of healthy controls had Sjogren's, which was significantly different, meaning that having fibro and Sjogren's or diabetes and Sjogren's did not occur by chance in 22% and 12.2%. Sicca is a term used by doctors to describe dry eyes and mouth, and xerostomia to describe dry mouth. It is interesting to note that about 20% of patients with Sjogren's do not have Sicca symptoms, according to a 2021 study. In a 2019 study, researchers stated that many patients with fibro complain of dry eyes and mouth, and many Sjogren's patients complain of fibro symptoms. And there is literature that suggests there is an interplay between the two conditions. I mean, I have dry eyes and dry mouth. My mouth especially is horrific. I find chewing anything that's a little bit dry extremely difficult, and I will bypass bread or crackers if I don't have something spread on it or to dip. Recently, the presence of novel tissue-specific autoantibodies of SP-1, CA6, and PSP has been observed in the early stages of Sjogren's. In a 2017 study, researchers stated that those three antibodies were noted in patients with Sjogren's, especially those with lower focus scores on lip biopsies, and those with early disease lacking antibodies to RO and LA, which are also called SS-A/RO and SS-B/LA. Doctors also look at ANA and rheumatoid factor, so there's a lot to consider. But back to that 2019 study, 32% tested positive for the early and or classic SS autoantibody markers. That's huge. I didn't know about the early markers, did you? In a 2020 study, patients with fibro, depression, and Sjogren's are common, but disagreements among physicians regarding treatment protocols are also common. However, in a 2021 study, patients with fibro and depression showed a non-significant risk of developing Sjogren's. But in patients with fibro and no depression, the risk of developing Sjogren's was 2.27 times higher. So depression, it really just doesn't matter when it comes to developing Sjogren's with your fibromyalgia. In that same 2021 study, researchers stated there's a higher risk of Sjogren's in patients with fibromyalgia, double the risk between the ages of 20 to 49, based on a nationwide population cohort study. There were over 74,000 patients with fibro and over 74,000 patients without fibro, a large study. But compared to men, women were 3.56 times at a higher risk of developing Sjogren's. I'd say there is an association between the two diseases. I think this 2024 study is an important one. 42 participants with fibromyalgia, 5 male and 37 female, were blood tested for anti-SSA/B antibodies and were found to be negative. They didn't have an autoimmune disease either that overlapped with their fibromyalgia. The median age was 44, and the median duration of fibro was 5 years. On a scale of 1 to 10, their median level of pain was 7. Half of the patients were taking pregabalin or Lyrica and tramadol. 21% were ANA positive, and 5% were rheumatoid factor positive, and antithyroid antibody positive at 21%. Elevated inflammatory markers were also observed with ESR at 7% and CRP at 12%. 35 of the 42 patients, or 83%, had dry eye symptoms, and 38 or 90% had dry mouth symptoms, and 26 or 62% had both dry eyes and dry mouth. I hope you enjoy these statistics as much as I do. It really brings things for me to life. I hope it does for you too. So, quote, F in patients with either dry eye or dry mouth had a similar proportion of positive autoantibodies and elevated inflammatory markers compared with those without these symptoms, unquote. That number was 40%. 40% of these primary fibromyalgia patients had autoantibodies such as rheumatoid factor, positive ANA, and antithyroid antibodies. Additionally, 17% had elevated inflammatory markers such as ESR or CRP. I know this was a small study. Actually, it was a pilot study, so we'll see a larger one in the future. Most clinical studies do start out small, but they result in telling a story, don't they? These researchers believe that Sjogren's is often undiagnosed in fibromyalgia patients. On a side note, pregabalin can cause dry mouth, and severe side effects can include swollen lymph nodes, skin rash, and joint pain, symptoms of Sjogren's. And uncommon side effects of tramadol are dry mouth and itching too. Obviously, there are other side effects of these drugs, but I chose to just share the ones that correlate with Sjogren's symptoms. So, a larger study comparing these symptoms to medication or patients on no medications would be enlightening. In addition, there wasn't a control group to compare to, so I would love to see that as well. So, what do you think? Do you have Sjogren's and fibromyalgia? Do you suspect, or does your doctor suspect an overlapping diagnosis? I didn't cover treatments in this video because I think it got long enough on its own. But if you'd like to learn more, we can explore that aspect of fibro and Sjogren treatment. So I hope you learned something. I send you gentle hugs and support. Love you.